I'm hoping it shows evidence of immunity. Most viruses, when you get antibodies, you get immunity. If there's every reason to think they should be protective, but until we prove it, we don't know. This is the study that's going to help prove it.
That's Dr. Sims, and he's talking about the nation's largest test for coronavirus antibodies. His hospital system, BEAUMONT Health in Michigan, is taking blood from its 38,000 employees, plus thousands of other people. These tests, they're not going to diagnose the virus. Instead, it finds out whether people have an immunity to it. That information will be used as scientists try to determine how the virus spreads and why some people get it and others don't. Health officials say this information could prove pivotal when states decide whether or not they can open back up. Let's bring in Dr. Calvin Sun to discuss that and much more. He an ER doctor in New York City. And doctor, before we get into all the questions of testing and everything else, how are you holding up? I think there's this misperception out there that we're on the other side of the curve and everything's clear now in New York City. From everything I've heard, you still got a packed ICU and the end is still not in sight.
So it's a tale of two cities. It depends on where in the hospital you're looking at. When you have all these people that are infecting each other before the lockdown, it'll take about 1 or 2 weeks for them to create symptoms, which was a surge that we saw in the emergency room the last 3 to 4 weeks that we talked about. But once you hit the lockdown, that takes another 2 to 3 weeks for the effect to happen. That's not what we're seeing. That is not what we're seeing today, not last week, today, when the patients are now trickling in because fewer people have exposed themselves because of the lockdown. So the emergency rooms are now finally decompressing. There are fewer patients coming in and therefore fewer patients to hospitalize. But what about the patients last week, the surge? All the people that got infected before the lockdown, we had to admit a lot of them to the hospital. It also takes them 1 or 2 weeks for them to go from being kind of sick to be coming to the emergency room and then to be admitted to then going to cardiac arrest and then dying, which is all happening today, but upstairs in the ICUs and the hospital floors. So it is a tale of two cities where downstairs we're finally decompressing because fewer people are coming in because of the lockdown, but all the people that came in last week are now dying in high numbers.
You know, doctor, it shocks me, and obviously you're far closer to it than the rest of us, how much we still don't know about this virus, in that first we thought it was only the elderly that would be susceptible to it. Not the case. We also heard that some people, it'll take a couple weeks to show itself. Now we're learning there's longer gestation periods before people show symptoms. Even people who get through it, the recovery experiences of these people are so different. Are even you guys on the front lines learning so much day by day about a virus that is very different than what we thought it was going to be a month ago?
Absolutely. We don't know enough still. We don't have enough time. And this takes months to years to be able to fully understand this disease process. I'm not a virologist. I'm not an epidemiologist. I'm a mercenary grunt in the trenches who sees things on a day-to-day basis in a very micro fashion. And what I'm seeing is this disease is unlike the flu and the cold in that it creates hypercoagulability, which means it clots everything. All my colleagues in the ICU telling me that the thing that is unique about their COVID-19 patients once they get to the ICU is that all the IV lines are clogged. Their breathing tube is clogged. People are dying unnecessarily from clots everywhere, including pulmonary embolisms, strokes, and things that look like a heart attack. And not only that, we've seen this virus bring patients that came in with just diarrhea or abdominal pain, things that we couldn't be impossible to screen if we just didn't have one disease process or organ to focus on. But now we have to focus on the entire body. And that's not what the flu does, and that's not what the cold does. And there's reports of reinfection or a bounce back of symptoms, or not in the context of having tests that are not even sensitive enough, which means that there's a huge chance that your negative result might be wrong. It's just a lack of time and resources, and we're doing our best in the moment to doing the best that we can with the little that we have.
You mentioned the testing, and to a layperson, doctor, it seems that because there hasn't been a coordinated plan and effort on the federal level to have uniform testing for everybody, states, even cities, are going about it themselves with different tests, with maybe a common goal, but still with different tests. It's hard to have a universal benchmark. To that end, what is, from your perspective, the obvious answer we need to have in terms of testing. What is the most important test you think that'll help us understand how big of a problem we have if people are put back out into the public, and the readiness of the kind of test and the answers the test would give? Tell us, if you were making policy, what's the most important thing about testing we still haven't solved?
It's not about what you do, but how you do it. We should test everyone if possible, if we had enough, but also you need to test them in the right places. They should not be coming to a healthcare setting such as the emergency room for a test, because once you come to the emergency room, you automatically will probably get it and be positive anyway by inhaling the air of a virus that is proven to survive in the air up to 3 hours after anyone coughs or sneezes. 3 hours. So what's the point of coming to the emergency room? You might as well just step in the emergency room and then get a certificate that you're positive because you just stayed in the emergency room. That's not a place to get tested, because whatever test you get is a moot point, because you can probably get coughed on by somebody 3 seconds later, because that's what happens in an emergency room, unlike a testing center where you're isolated one by one in a car, in a drive-through testing, or a test kit mailed to you in the privacy of your home. Very unlikely in your home somebody, like a patient, will cough in your face 5 seconds afterwards to render that test useless and inaccurate. And multiple testing and testing the people who are higher risk, that all needs to be put in place about how to test, not about just what to test.
I thought of you and other ER docs that I've been talking to over the last few weeks when we're having this conversation. I'm not dragging the politics of it, doctor, but this idea of opening up this country or 2 or 3 weeks when we don't have the testing figured out. You guys are finally getting a chance to breathe, and we still don't have surplus equipment, etc. If there will be a second wave, but if it's not delayed until at least the fall or the winter, when people can get better equipped to deal with this, and it happens sooner, like the summer, physically, let alone even emotionally, that you guys would be thrown back into it all over again that soon. Are you guys concerned that you guys could handle a second wave that fast?
I hope there's no second wave. I hope we're prepared for a second wave. I hope we're more, our vaccine comes around before the second wave, but the second wave will likely come if we break quarantine, no matter what, whenever that is, until a vaccine comes around. Or we have this last long enough for the virus to burn itself out, which means more people will die unnecessarily, which I find more ethically inhumane. So it's a very difficult decision what to do in that scenario. But for us on the ground, this is a moment to decompress in the emergency room. I'm going to enjoy it as much as I can enjoy it, as appropriate as that word is. But I'm going to take advantage of this moment to decompress as much as I can so that we are ready for a second wave that happens. And if it does happen, so be it. I just hope that it doesn't. Westchester already is seeing a rebound of cases. So I think it's inevitable.
Well, doctor, I remember the last time I spoke for our audience in thanking you, said, if you want to thank me, respect the quarantine and don't go out there so you don't come into my ER. So I keep reminding our audience of that as well if they want to thank the amazing folks in the front lines, yourselves, the RNs, and all the other folks who make it happen. Thank you as always, doctor. I appreciate the time. All right, everyone, we come back. Famed attorney Lisa Bloom, she'll join us to discuss some of the legal issues that are popping up due to coronavirus, including the rights of workers and employees, especially in the medical field.